Hey, good morning. It's Mrs. B again. I just wanted to show you a new piece of equipment that we received here in Health Professions. It is called an O2 concentrator. I'm happy to say that it arrived last week, and I wanted to do a quick little video on exactly how it works and what it does. This is actually a beautiful piece of machinery. I feel very lucky that we have this here at school. It is a concentrator. I know that you have probably seen when you went to visit people in the hospital, or even when I was teaching the respiratory system and showing you other different pieces of equipment, how oxygen is delivered supplementally if someone's oxygen saturation goes down below 95%, 90%, depending on what their need is. Maybe they had surgery, perhaps they have pneumonia, maybe they were a COVID patient, or a patient that has chronic obstructive pulmonary disease. Many different reasons that someone may need supplemental oxygen, and their body is not able to actually exchange in their alveoli down deep in their lungs the oxygen and carbon dioxide, so they are requiring supplemental. This is, as I have shown you in the past, is just a normal, simple nasal cannula. It has a tubing that would be hooked up to the machine itself, and it goes into the nostrils. There is a direction that goes like this. That is the direction that the nostrils actually are. So we will put this in our mannequin. Okay, sir. And secure it. It goes behind the ears. Something I want to mention to you is please don't forget to check the condition of the skin and the ears and the auricles, because this tubing, although it's flexible, it can put pressure on the ears themselves and cause breakdown. So that's something that you want to make sure that you're checking. And the tubing goes here and it leads to the concentrator machine. Before I actually turn this on, I want to show you how this actually works. As you know, I've explained to you in the past that room air that we breathe contains 21% oxygen. That is normal for us to be able to sustain life and to perform our activities of daily living. However, when patients require more oxygen, the concentrator actually draws air in, the room air, concentrates it, and it can deliver up to 5 liters of oxygen to a patient. On the side here is a filter, to get this out of here, because it's filtering the impurities out of the air, and the filter comes up. You can actually wash this. It comes out, and you would wash this. Now, by standards, you say, how long can you actually go? Well, usually every 28, 30 days, it's on the cycle for cleaning. Same thing with the oxygen cannula. They're disposable. You would replace that. And the bubbler here is actually providing humidification, and there's water in there that when the oxygen bubbles, which you'll see in a couple of moments, that it actually humidifies the oxygen so that it doesn't dry out the nasal passages and mucous membranes. So I'm going to put this back in, and it pops in and out. We have it plugged into the wall, and this is our humidification bottle. Let's take that out and show you. And there's the fill line inside. You actually will have the tube that sucks it up, and it's in its little space, kept securely with a rubber band. Now this goes to the concentrator itself. Now here is exactly what it is delivering. You turn it on and it will say exactly what it's doing, and this is the flow meter here. So you can put it down to 0, you can put it to 1. Now there is a little tiny silver ball in here. If your patient is ordered to have 2 liters of oxygen per minute supplemental, you would put the silver ball right in between the two, okay? So whatever amount is ordered for your patient is exactly where. So we're gonna look for 2 liters, and we'll put it to 2 liters. And Mr. Jones over here is going to be receiving 2 liters of supplemental oxygen through the nasal cannula, and he should be breathing pretty effectively and be very comfortable. When someone is on oxygen, we talked about in class as well, about monitoring the oxygen saturation. We have that pulse oximeter. They would be ordered to have that at least every shift to make sure that their oxygen saturation is adequate. And also, if it's on the low side, then what they would do is perhaps they would order for more oxygen at 3 liters perhaps. But that is basically our oxygen concentrator, and I wanted to show you guys the new equipment that we received and how it works. And it'll be here for school for you guys to be able to, I don't want to say play with, but to use and to get to know and to just feel it out a little bit. Okay, thank you.